How do you recognize myoclonic seizures? Imagine feeling perfectly alert but suddenly experiencing quick, involuntary muscle jerks. That's often what happens during a myoclonic seizure. These seizures are characterized by sudden, brief muscle twitches or jerks that usually last just a second or two. They can happen in one muscle or multiple muscles at the same time, often in rapid succession. During these jerks, the person remains fully awake and aware, meaning they do not lose consciousness. Most often, myoclonic seizures affect the upper body, especially the neck, shoulders, and upper arms. You might notice these jerks happening shortly after waking up, but they can also occur at other times of the day. Stress, fatigue, or flashing lights can sometimes trigger these seizures in some individuals. The key features to recognize include sudden, shock-like muscle contractions that may happen alone or in clusters. Usually, both sides of the body are affected symmetrically, but sometimes the jerks can be localized to one area. Each jerk is very brief, lasting only a second or two, and the person stays conscious throughout. Because these seizures often happen soon after waking or during tiredness, they are commonly associated with epilepsy syndromes like juvenile myoclonic epilepsy, which usually begins in adolescence or early adulthood. But they can also be caused by other neurological conditions or metabolic issues. Diagnosing myoclonic seizures involves a detailed medical history and physical exam. Doctors often use tests like an electroencephalogram, which records brain electrical activity, to look for abnormal patterns. Brain imaging scans like MRI can help rule out structural problems. Blood tests may be done to check for metabolic causes. Sometimes, additional tests like electromyography or evoked potentials are used to analyze muscle activity and seizure origin. If you notice sudden, brief muscle jerks that happen repeatedly or are linked with other seizure types, it's important to see a healthcare professional. Proper diagnosis is essential for developing an effective treatment plan, which often includes medications called antiepileptic drugs. These can help control the seizures and improve quality of life. In summary, recognizing myoclonic seizures involves noting sudden, brief muscle jerks that happen with awareness intact, often after waking up, and confirming the diagnosis through clinical evaluation and diagnostic tests. Always consult a healthcare provider for personalized assessment and care.